Hi everybody, we're going to go ahead and talk about bag technique and what you need to have in your bag as well as some hand hygiene. So before we look at the bag technique, we need to look at what has to be in the bag. So you have to have some barriers, you can have your blood pressure cuff and stethoscope, paper towels, you're going to have a CPR shield or mask, thermometer, you want to have some antibacterial soap as well as some alcohol sanitizer. If you're a nurse, you may have some bandages or some supplies here. One note on that, you always want to make sure you check the expiration date on your supplies and make sure that you're always having supplies that are up to date. Therapy, you may have a gait belt, some alcohol cleaners, as well as possibly a pulse oximeter. And from your protective equipment, you need to have a biohazardous spill kit, as well as a personal protection kit here. So we're talking about bag technique, and when you set up your bag, now you may have a different type of bag, depends if you have a rolling bag or you have a doctor's choice bag, doesn't really matter, but you need to have one section of your bag that's considered clean. So how you set your bag up is going to be where you want to have your cleaning supplies on the exterior of your bag. So in this case, I'm going to go ahead and put my soap and my alcohol sanitizer here. I have some antimicrobial wipes. Now, I would probably put these in a Ziploc bag so it doesn't take too much space, but in this case, I'm just going to put it right there. My paper towels, if I have some room, I can keep those on the outside as well. And because this bag has a back side to it, I'm going to put my barriers right there. And then any other objects that you're going to be engaging the patient with or touching on the patient that you have to clean between patients is going to go into your clean section here. So I'm going to go ahead and put my blood pressure cuff inside here. And I'll have my CPR shield. In this case, I have a little sleeve I can put in, my gait belt, pulse oximeter, and thermometer. Now, depending on your bag type, if you have a couple zippers, you can actually take some of the equipment that you're not going to probably pull out often, such as your biohazardous spill kit and your universal precaution kit. You can put those in another section and keep those out of the way so you're not having to get to those there. And my alcohol wipes, I would probably put these in a little Ziploc bag, and I can keep those in an area that I'm going to be cleaning because I'm going to use those for cleaning purposes. And if I have my supplies, again, I just have some demos here, but I would put these in a Ziploc bag, and I put those and organize those in my bag here as well. So I have my cleaning supplies on the outside, have my clean section in the middle here, and I can zip it up and I'm good to go there. So when I'm going to go to a house, a couple things is you are allowed to go ahead and hang your bag on a chair or a door handle. Or if you're going to put it down on any type of surface, whether it's a chair or you put it on the table, you have to put some barrier down. Now keep in mind that you do not want to put it on the floor. If at all possible, depending on the patient's home, you may have that maybe your only option. If that's the case, then you put your barriers down and do the best you can. But you always want to elevate it and make sure that you keep it on an elevated surface. So if I'm going to come into the home here, I'm going to take my barriers out. And depending on what kind of barriers you have, you could use the ones that we supply as a company, or you can use paper towels. You can actually use pet pads, which are very large. It doesn't really matter, but you have to have some surface. And I tend to use two barriers because I want to have some room to put my equipment on here. Now, when you go into the house here, one of the first things you want to do is you always want to sanitize your hands. You want to make sure the patient's aware of you sanitizing your hands. So when you go into the house, if my hands are clean, they're not dirty or soiled, it's perfectly acceptable to go ahead and use the alcohol sanitizer that comes in your pack. And I would go ahead and I can put a squirt here on that and clean my hands as such here. So one of the ways to make sure you're going to have no issues with contaminating or cross-contaminating your equipment with patients is to make sure you open your bag, bring everything out, put it down before you work with the patient, and then before you put it back in your bag, you only return it to this section here so that you're not going to be taking something and taking from your bag, touching the patient, bringing it back and sticking it in the bag. In that case, you're going to have a real high risk of getting contamination between patients. So in this case, I'm going to open my bag. I'm going to open my bag and take out whatever equipment I'm going to work with the patient. So in this case, take my blood pressure cuff out. I'm not going to bring everything out, but I'm going to bring out maybe my thermometer. And if I had, as a therapist, I may have my gait belt out here, and I'm going to set it here. So whatever I'm taking out, I'm going to set on this barrier here. I'm going to go ahead and work with my patient. So as I use my gate belt. When I put it back, I'm not going to put it in the bag. I'm going to set it back here. Same thing with my blood pressure cuff. I will work with the patient and bring it back to this section here. So after you're done with working with the patient, you want to clean your equipment here. So in this case, I have my antimicrobial wipes. And it's a new packet, so if I pulled one out here, I'd pull it on out. And I would go ahead and clean each of my equipments with the wipes. I can use also the alcohol wipes here as well. And make sure I clean all my equipment before I actually put it back in the bag there. It's even recommended to use a single wipe on each item. Before I put it in though, I want to clean my hands one more time before I bring my items and put it back in the bag there. So you always want to make sure that you clean them before you go back into the bag. And if I put everything back in here, I've only had to enter my bag a couple times, and in this case I'm going to leave this out. And so I have a very, very minimal risk of not being compliant with that there. So if you have any questions, talk to your directors or DCS about that technique or see our policy procedure. Thank you.